Hello and welcome. I'm delighted to share some valuable information with you today about healthy fruits that can help manage high blood pressure, especially if you're over 60. High blood pressure affects many of us as we age, but nature has provided wonderful foods that can help us maintain our health naturally. In this short video, I'll introduce you to 5 delicious fruits that are not only enjoyable to eat but also particularly beneficial for those of us managing hypertension. These simple additions to your daily diet, along with regular gentle exercise and proper medication if prescribed by your doctor, can make a meaningful difference in your heart health. Let's discover these natural treasures together. 1. Bananas, nature's perfect blood pressure medicine. Our first heart-healthy fruit is the remarkable banana, a powerhouse for managing hypertension. This convenient, naturally packaged fruit offers exceptional benefits for those over 60 with high blood pressure. Bananas contain approximately 420 milligrams of potassium per medium fruit, which actively counterbalances sodium in your bloodstream. This mineral balance is crucial because excess sodium causes your body to retain water, increasing blood volume and putting pressure on arterial walls. The potassium in bananas helps flush excess sodium through your kidneys, reducing this pressure naturally. Additionally, bananas contain unique compounds called ACE inhibitors that work similarly to common blood pressure medications. These natural compounds help prevent the angiotensin-converting enzyme from producing angiotensin II, a substance that narrows your blood vessels. Clinical studies have shown that individuals consuming 2 bananas daily for just 2 weeks can lower their blood pressure by up to 10% due to this powerful combination of potassium and natural ACE inhibitors. Bananas also contain heart-healthy fiber, about 3 g per fruit, which helps reduce cholesterol and stabilizes blood sugar, both critical factors for cardiovascular health as we age. Their magnesium content, about 32 milligrams per fruit, further supports healthy blood pressure by helping blood vessels relax. For maximum benefits, choose bananas with slight green tips for lower sugar content. They can be incorporated into your daily routine as morning oatmeal toppings, afternoon snacks, or even blended into smoothies for those with dental concerns. Remember, consistency is key. Making bananas a daily habit, rather than an occasional treat, provides the sustained benefits needed for long-term blood pressure management. 2. Watermelon, the refreshing blood pressure reducer. Our second remarkable fruit for managing hypertension is watermelon, a juicy, refreshing treat that works wonders for your cardiovascular system, especially during warmer months. Watermelon contains an exceptional amino acid called L-citrulline, which your body converts to L-arginine, then to nitric oxide, a powerful vasodilator that relaxes and widens blood vessels. Research published in the American Journal of Hypertension found that watermelon extract supplementation reduced blood pressure in hypertensive adults by 15 mm of mercury systolic and 7 mm of mercury diastolic over just 6 weeks. 1 cup of watermelon, about 154 g, provides approximately 170 milligrams of potassium while being incredibly low in sodium, less than 3 milligrams per serving. This favorable sodium-potassium ratio is precisely what hypertensive individuals need to naturally regulate blood pressure. Watermelon is also 92% water, making it excellent for maintaining proper hydration, which is critical for blood pressure regulation. Dehydration causes blood to become thicker, forcing your heart to work harder to pump it through your vessels. The vibrant red color comes from lycopene, a powerful antioxidant that helps protect your arterial walls from damage and reduces inflammation in blood vessels. Watermelon actually contains 40% more lycopene than raw tomatoes, with research showing it may help prevent atherosclerosis, hardening of arteries. For maximum benefits, choose fully ripened watermelon, as the L-citrulline content increases as the fruit ripens. The rind contains even higher concentrations of citrulline, so consider adding small amounts of the white part just beneath the green skin to your servings. Enjoy watermelon as a refreshing snack, blend it into smoothies, or create a cooling summer salad with mint leaves. For those managing diabetes alongside hypertension, portion control is important due to watermelon's natural sugars. Consistent consumption of 2 cups weekly has been associated with improved blood pressure readings in clinical studies with adults over 65. 3. Berries, tiny fruits with tremendous blood pressure benefits. Our third powerful category for managing hypertension includes blueberries, strawberries, and other berries. These small but mighty fruits offer exceptional cardiovascular protection for adults over 60. Berries contain specialized compounds called anthocyanins, powerful antioxidants that give these fruits their vibrant colors. A landmark study in the American Journal of Clinical Nutrition followed 34,000 people and found those consuming the highest amounts of anthocyanins, primarily from berries, experienced an 8% reduction in hypertension risk compared to those consuming the lowest amounts. Blueberries specifically contain pterostilbene, a compound closely related to resveratrol that helps reduce blood pressure by activating nitric oxide production. Research from Florida State University found that just 1 cup of blueberries daily for 8 weeks reduced systolic blood pressure by 5.1% and diastolic pressure by 6.3% in postmenopausal women with prehypertension. Strawberries provide exceptional vascular benefits through their high content of polyphenol and vitamin C. A 100 g serving contains approximately 60 mg of vitamin C, which strengthens blood vessel walls and improves their elasticity. This enhanced elasticity allows vessels to expand and contract more efficiently with each heartbeat, reducing pressure within the circulatory system. Both berries are also rich in soluble fiber, with blueberries providing 3.6 g and strawberries 2 g per cup. This soluble fiber helps reduce LDL cholesterol levels, which otherwise contribute to arterial plaque formation and increased blood pressure. For older adults with inflammation-related hypertension, berries offer significant anti-inflammatory properties. Regular consumption reduces C-reactive protein and other inflammatory markers that contribute to vascular stiffness. To maximize benefits, consume berries fresh whenever possible, as freezing can reduce some beneficial compounds. However, frozen berries are still excellent alternatives when fresh options aren't available. Aim for half a cup daily, either alone as a snack, added to whole grain cereal, or blended into smoothies with a banana for complementary benefits. Clinical research indicates that consistent berry consumption for 12 weeks or longer provides the most significant blood pressure improvements, emphasizing the importance of making these fruits a regular part of your dietary routine. 4. Kiwi, the overlooked blood pressure superfruit. Our fourth remarkable fruit for hypertension management is kiwi, an often underestimated green powerhouse that offers exceptional benefits for older adults with high blood pressure. Kiwi contains an impressive concentration of potassium, approximately 215 mg per medium fruit. This critical mineral works synergistically with the fruit's naturally low sodium content, only 2 mg per kiwi, to create an optimal electrolyte balance for blood pressure regulation. Research published in the American Heart Journal demonstrates that this favorable potassium-to-sodium ratio helps the kidneys eliminate excess sodium through urine, directly lowering blood pressure. What truly distinguishes kiwi is its exceptional vitamin C content. One medium fruit provides 64 mg, which is 71% of the daily recommended intake for adults over 60. This surpasses even oranges in concentration. A clinical study from the University of Oslo found that participants consuming 3 kiwis daily for 8 weeks experienced a significant reduction in both systolic and diastolic blood pressure by an average of 10 mm of mercury and 9 mm of mercury respectively. Kiwi contains unique enzymes called actinidin and lutein that reduce inflammation in blood vessels. This anti-inflammatory action helps prevent arterial stiffness, a common issue in aging adults that contributes significantly to hypertension. The fruit's natural fiber content, about 2.1 g per kiwi, further supports cardiovascular health by helping maintain healthy cholesterol levels. For adults over 60 taking blood pressure medications, kiwi offers an additional benefit. Its high vitamin K content, 28 micrograms per fruit, helps counterbalance the vitamin K depletion caused by certain diuretics and beta blockers, supporting proper bone health alongside cardiovascular benefits. To maximize absorption of kiwi's beneficial compounds, consume the fruit ripe but firm, and consider eating the skin, which contains additional fiber and nutrients. For those with sensitive digestive systems, the gold-fleshed varieties typically cause less irritation than green kiwis. Clinical research from Taipei Medical University showed that consuming 2 kiwis daily for 12 weeks lowered systolic blood pressure by an average of 11.7 points in older adults with moderately elevated blood pressure, demonstrating that consistency is key to experiencing kiwi's full benefits. Incorporate kiwi into your routine by slicing it into morning yogurt, adding it to salads, or enjoying it as a refreshing afternoon snack to help maintain stable blood pressure throughout the day. 5. Citrus fruits, nature's blood pressure defenders. Our fifth and final category highlights oranges, tangerines, and other citrus fruits, extraordinary choices for managing hypertension in adults over 60. Citrus fruits contain specialized compounds called flavonoids, particularly hesperidin and naringenin, which have remarkable effects on cardiovascular health. Research published in the Journal of Nutrition found that these compounds significantly improve blood vessel function by enhancing nitric oxide production, the body's natural vasodilator. A clinical trial involving 101 adults with hypertension showed that consuming citrus flavonoids daily for 6 weeks reduced systolic blood pressure by an average of 5.4 mm of mercury and diastolic pressure by 2.5 mm of mercury. A medium orange provides approximately 240 mg of potassium while containing virtually no sodium, creating an ideal electrolyte profile for blood pressure regulation. This potassium content helps neutralize the blood pressure-raising effects of sodium in your diet. The American Heart Association notes that this potassium-sodium balance is particularly critical for adults over 60, as sodium sensitivity increases with age. Citrus fruits are exceptionally rich in vitamin C. One medium orange contains about 70 mg, while a tangerine provides 26 mg. This powerful antioxidant strengthens blood vessels and improves their elasticity, allowing them to dilate more efficiently. A meta-analysis of 29 clinical trials published in the American Journal of Clinical Nutrition concluded that vitamin C supplementation of just 500 mg daily, equivalent to about 7 oranges, reduced systolic blood pressure by 4.9 mm of mercury and diastolic by 1.7 mm of mercury. The soluble fiber in citrus, particularly pectin, helps reduce cholesterol levels that otherwise contribute to arterial plaque and increased blood pressure. One medium orange provides approximately 3 g of fiber, with about 60% being the cholesterol-lowering soluble type. For older adults taking certain medications, it's important to note that grapefruit specifically can interact with some blood pressure medications and statins. However, oranges and tangerines do not typically cause these interactions and remain excellent choices. Research from the University of Western Australia demonstrated that participants consuming daily citrus fruit experienced a 10 to 15% improvement in blood vessel function after just 30 days, with benefits increasing over 6 months of regular consumption. For maximum benefit, consume whole fruits rather than juices to retain the fiber content. Consider adding orange segments to salads, enjoying a tangerine as a mid-morning snack, or keeping small mandarin oranges available as convenient, portion-controlled options that are also easier to peel for those with arthritis. We've explored 5 remarkable fruits that can help manage high blood pressure naturally for those over 60. Let's remember their key benefits. Bananas provide essential potassium and natural ACE inhibitors that help relax blood vessels and balance sodium levels in your body. Watermelon delivers L-citrulline, which your body converts to nitric oxide, a powerful compound that dilates your blood vessels and improves circulation. Berries like blueberries and strawberries contain anthocyanins and polyphenol that reduce inflammation and improve blood vessel function, with research showing significant pressure reductions in just 8 weeks. Kiwi offers an exceptional vitamin C and potassium combination that strengthens blood vessels and helps eliminate excess sodium, with studies showing impressive 10-point reductions in blood pressure. Citrus fruits provide flavonoids that enhance nitric oxide production and improve vascular health, while their potassium content and soluble fiber work together to regulate pressure naturally. Remember, consistency is the key to experiencing these benefits. Try incorporating at least 3 of these fruits into your daily diet, ideally spreading them throughout your day for sustained effects. While these natural approaches are powerful, they work best as part of a comprehensive approach. Continue taking any prescribed medications, maintain regular exercise, limit sodium intake, and consult with your healthcare provider about your blood pressure management plan. By embracing these delicious, natural allies for heart health, you're taking an important step toward maintaining your independence and vitality in the years ahead. Here's to your health and well-being.